Hello, I'm going to do this instructional video as an adjunct to the care that you're probably receiving from myself or somebody qualified to help you with painful conditions and resolving your painful condition. These are 9 maneuvers. They're well suited to somebody in early phase 2 rehabilitation. Uses a suspension strap. You can find a variety of them at retailers online and in store. Choose one that is safe for you, appropriate for your body weight, and intended use. I'm going to speak while I do the maneuver, and hopefully what I talk about will help you be more aware of little subtle techniques that can make your time more useful. Each maneuver will be done for 60 seconds. There'll be a 10-second transition period. There are 9 maneuvers, therefore the exercise portion of this video will take about 10-11 minutes. In terms of how many times you should go through it, again, your professional you're working with will guide you in that regard. In terms of how to make it more difficult, again, your health professional will educate you in that regard. So I'm going to start the timer and get started here. There we go. We're going to start with rowing, okay? So you're going to make your spine nice and long, okay? Shoulders away from your ears, and I'm going to allow myself to go back. I'm going to pull myself back to vertical with my arms. I'm going to try to keep my spine very similar in terms of its long posture the whole time. I'm going to bring my shoulder blades toward the midline of my back as I pull with my hands toward me, and I'm going to allow my shoulder blades to separate a little bit, not a lot, when I go back to hands in front. I am kind of rocking back over my heels. I'm periodically thinking crown of the head to the ceiling, or crown of the head away from my heels, heels away from the crown of my head. That way it becomes a core exercise, as well as a upper back exercise. Great exercise for most people, because most people have to sit for a long time each day or work over a bench. Now we're going to do a chair squat. So you can actually have the chair behind you to ensure that each squat is the same depth. You're going to put your feet comfortable distance apart, more weight through the heels, and you're going to lower yourself, and you're going to raise yourself. These are going to make it a little easier. So my knees are apart a particular distance here. My shins are more or less straight up and down when you look at me from the front. And then my knees are going to stay the same distance apart as I go through this movement. If you want to have a mirror in front of you, that's a helpful thing. Pushing again a little more through my heels and my forefeet so that I use muscles in my legs other than my calves. How low do you go? Now it depends on your comfort level and the guidance you receive from whoever's working with you. As you go low, maybe stick your butt out a little bit to encourage pivoting from the hips rather than your pelvis rolling backward and pivoting your lower back. The idea here is the ball and socket joint of your hips is where most of your movement comes from. It's more well designed to do it than your low back is. Now we're going to do low fly, which just means that my elbows are going to stay at the same angle and my hands are going to separate as I do the maneuver. So a little different than a row. It does slightly different muscles. Same thing in terms of a tall posture. And then I'm going to separate my hands. As I separate my hands, I'm going to bring my blades toward the midline. And I'm going to allow my blades to leave my midline a little bit. I'm trying to keep my knees fairly straight without bending them over backward or jamming them at the end of their range. Tall posture. Push my crown of my head away from my heels. Push my heels away from the crown of my head. Pace dictated by how good you can keep your technique at a particular speed. Of course, at the beginning, it's not going to be a fast pace, but as you get better at this, it's going to be a quicker pace. But your technique will still be good. Again, if you have a mirror to look at, that's great. If you have a relative, they love to look at this stuff too and make sure you're doing it just right. So there's a possibility there. We just did low fly. Now we're going to do a wide squat. I'm going to separate my legs quite a bit, and then I'm going to put my feet at a rotation they like to rotate out to. And I'm going to lower myself down, and just like the chair squat, I'm going to put a little more weight through my heels. And I'm going to stick my butt out a little bit as I lower myself so that I encourage pivoting around that hip, ball and socket joint, and I discourage a lot of movement from coming from the what's called lumbosacral junction, or the back where it attaches to the pelvis. It's a little easier to do this when you have these straps because you can lean against them a little bit. How low do you go? You know, that'll depend on your guidance from your therapist. But the good thing about this maneuver is your kneecaps don't take quite the beating here because I've got my feet really wide apart, and means that when I bend my knees, my thigh muscles are not going to pull my back sides of my kneecaps into my thighs so much. So remember to keep your butt stuck out a little bit when you go down. Yeah. We're going to do diagonal movements. It's kind of like a fly with your hands going diagonal one way, diagonal the other way. Mirrors are great. I'm using the camera now as a mirror. Am I sticking myself out backwards? Am I doing that? Well, that's a little extreme. Am I sagging? That's not so good either. Do I have it dialed in so I'm tall? I'm not sticking my stomach and chest way out, but there's a little protrusion there to counter the effect of my backward lean when I go to the end position. Pinching my blades together as my hands separate, allowing my blades to come apart a bit as my hands go back to the midline, but never slouching. Pushing through my heels, pushing my heels away from the crown of my head, pushing the crown of the head away from the heels. All right. The slope of this is determined by how close you put your feet to the attachment point of the suspension unit. Talk to your professional about what they want you to do. We're going to do single-legged squats with the help of this. They can be super shallow, and they may have to be. Standing on one leg, you're going to go down and put one leg in front of you. Second time, you're going to put the leg behind you. Third time, you're going to put it out to the side. Fourth time, you're going to put it across the back. And every time you do this, you're going to look down and try to make sure that your knee isn't wobbling left and right, or isn't falling to the inside all the time. And you're going to push through your heel more. You're going to be feeling the comfort level that you have through your knee, and follow the guidance given to you by your rehab professional in terms of how much pain to provoke, if to provoke any. And you're just going to keep on doing that. Now, we're doing one leg at a time. I'm getting kind of tired. If that happens with you, you can just take a wee break. Just put your foot down for a sec and then get back to it. That's quite okay. We're on to rotation. A little bit of core stuff here. So I've got two hands on my handle. Tall posture. How am I doing there? Is it nice and long? Or am I this way? Or am I that way? I'm going to be in the middle of those two things. Let myself out. Let my chest turn. Bring my chest around. You can do one side only, which is going to make particular sets of muscles work again and again and again. They're going to get a little more tired. Or you can go one side to the other, which shares the work a little bit. I'm going to talk a bit about the shoulder joint here. As my chest goes away from my hand that's holding the handles, my shoulder blade is going to get pulled to the inside. It's going to get pulled to the midline. Okay, that's going to help me get mobility from my shoulder blade on my rib cage, and a lot of good comes from that. Monitor the discomfort in this vicinity here, and follow the guidelines given to you by your health professional. There's modifications. I'll talk about that when we do the other side. Now we're going to step on the left leg here. Okay, yeah. So here we go with the straps to help. Tall posture. I'm squatting down. And in front, going behind, going to go up to the side, going to go the other way, and I'm just going to repeat that. I have a neutral posture on my upper body. I'm not like way into a row, and I certainly don't have my hands way out in front of me. It's kind of in the middle there. Holding on to the suspension straps allows me to do these a little bit with a little less effort than if I didn't have them at all. balance assist, which is kind of nice. If you can't do this with on one foot, even super shallow like this, you can touch one foot down and put most of your weight on the other foot, you know? Or you can just go back into a chair squat, or you can skip it all together. Talk to your person you're working with for the advice that's best for you. Okay? Good show. Now we're rotating the other way. So again, this is demonstrating doing one side and repeatedly doing one side. You don't have to do that. You can go one side to the other. Whatever challenges things without overwhelming them. In order to get things to grow, you have to ask them to do more than what they're used to. It has to be done routinely enough that the body figures out that this is a routine demand. It better reorganize itself. But you can't expose your body to intensities that are beyond its ability to adapt to. It'll weaken if you do that. It'll strengthen if you find that challenge that is more than what it's used to, but not beyond its adaptive capabilities. And monitoring comfort is an important consideration also. Talk to your professional about what discomfort, qualities, and intensities will suit you best. And this is the last maneuver. And that's the deal. So these things here can sometimes, will often make some exercises that are body weight oriented exercises easier to do than if you didn't have them. And this video is ending at 12 minutes. So yeah, about 10 minutes worth of exercise work. I hope this is helpful to you. Thank you.